The Birthing Kit Foundation of Australia was formed in 2006 and it grew out of the Zonda Birthing Kit project. We make simple birthing kits to send out to poor women in remote areas in developing countries to give them a clean birthing environment. And we also run training programs to enhance the outcomes.
The birthing kits are needed especially in the rural areas, because the women are not able to access the hospital, and therefore the traditional birth attendants require this kit in order to deliver the women in their homes.
The foundation grew out of the Zonda Birthing Kit project, and in the 1990s, when Joy O'Hazy, one of our board members, had the idea, we started making our first kits in 1999.
The Zonda International Clubs of Australia are enormously important to the foundation. They're the major donors and the major assemblers of the kits, and there are over 100 clubs in Australia taking part in this project.
The Birthing Kit Foundation delivers kits and runs training programs in the Asia Pacific and Africa. And we've chosen those areas particularly because AusAid has focused on those areas, and they really want us, and we work with them closely, to focus on the Millennium Development Goals.
The Millennium Development Goals were a set of targets that were agreed upon by 189 countries, including Australia, in the year 2000, and the aim was to decrease poverty and to advance human development by the year 2015. The Millennium Development Goals the Birthing Kit Foundation Australia addresses are: number 3, to promote gender equality and empower women; number 4, to reduce infant mortality; number 5, to improve women's health; and number 6, to reduce HIV/AIDS and other transmissible diseases.
The World Health Organisation hopes that every woman will have a skilled birth attendant with them when they're having their babies. And that, for me, is really significant. So here in Australia we train midwives, or we educate midwives for midwifery practice, but out in developing countries they don't have midwives, and so we need to make sure that there's training of birth attendants so that all the women can have a birth attendant with them. And if we can get those birth attendants trained, give them a birthing kit, then we can ensure that those women are birthing with the trained attendant and in a safe environment.
The foundation activities are based on development, and to make the issue of clean birthing sustainable in these communities there needs to be education. And although there are established networks for distribution of the kits, there needs to be training beyond the traditional practices. One of the tools we use in our training program is the pictorial training manual. This is because the level of literacy is low and there are many different languages in these regions. The impact of the training programs on the communities has been a very positive one. There's been a strengthening of the relationship between health authorities and the villagers, and an awareness of the need for clean birthing practices. And this knowledge has been passed on throughout the entire community.
Training and distributing these kits really is the key to promoting gender equality, because at the moment these traditional birth attendants are just really taken for granted as the woman just to be called when the baby's head is coming and to let that baby out. So once she's trained, she's a woman of knowledge, she's a woman of capability. In her hand is the equipment to make a clean delivery, a safe delivery. The training is really bringing these traditional birth attendants into an important place in the society.
Over 80% of Cambodia's population live remotely, so the training of traditional birth attendants and the resourcing of traditional birth attendants is really important.
The woman is delivering on an uncleaned area in the first place. The newborn baby is put onto that unclean area. The kit has got a sheet of plastic which is clean. The kit has got soap. The kit has got a clean blade to cut the baby's cord. Through that, the baby's not going to get tetanus. Neonatal tetanus is a very big killer in newborn babies.
Traditional homes and huts in Cambodia are on dirt floors. They don't have electricity and running water, so it is they use what they can grab. So if we can resource them with a birthing kit, we know that they've got a clean place to birth, they've got clean implements, and to reduce the infection rate is a massive part of helping women survive labour.
These simple kits cost less than a cup of coffee, and they make a significant difference to the mothers giving birth in developing countries.
Now, an assembly day is where groups of people gather together and assemble the kits. So we get all the supplies from overseas and from locally in bulk, and then they are sent out to different clubs and groups in 1000s or 600s, depending on how many they're making on the day. Then those women and men and students and children all get together and put the kits together. A group of 30 or 40 volunteers can make 1,000 kits in about 2 hours, and a larger, more experienced group have been known to make 8,000 in a day.
These bags have been handed over to the Australian Defence Force to be flown to Afghanistan. Since 2008, the Australian Defence Force have shipped over 70,000 birthing kits from Australia to Afghanistan.
One of the Foundation's main long-term aims is to achieve sustainability, and that's with in-country production of kits where the supplies are sourced and the kits are made in-country, and also to achieve sustainability with training programs where further training programs are needed. The training programs are funded locally.
There is a big need for the kit to be made locally so that at least we can have that sustainability. But at the moment the link is not there. We need to work with the local NGOs who are on the ground.
The long-term role of the Foundation is to work with the local ministries of health in the supply of the kits and the training programs. I think the kits are targeted to women in really remote regions, so I believe that it will be a long, long time before the Foundation has done all of its work.
Oh.